AMPATH is an acronym that stands for Academic Model Providing Access to Healthcare, but starting with care. So building care delivery, strengthening health systems, and then layering on top of that foundation now meaningful capacity building and research. Ghana has a quite well-developed public sector health system that is tiered, meaning that it has referral hospitals, district hospitals, health centers. Most of the access to advanced care is there in the southern part of the country. And the reality is that in the north, there are fewer resources. There are fewer physicians, there are fewer other healthcare workers, less access to medications, and worse health statistics. So we've been partnering then with the Dean of the School of Medicine, as well as the larger University for Development Studies in Tamale, northern Ghana, as well as the affiliated teaching hospital, the Tamale Teaching Hospital. And we're leveraging the existing relationships with the rest of the Ghana Health Services that already operate in the north.
Primary focus is the values, building a program in trust, respect, and mutually beneficial partnerships. That the Ghana team is not dependent on the New York team. We want to be able to say that faculty members, medical students in New York and in Ghana have learned from each other and are going on to become better clinicians who understand the needs of the community. Ghanaian partners already have embraced innovative curriculum, innovative approaches to care, research, and training. And that is the hallmark of the Grossman School of Medicine. So we see a fit in terms of our ideals and our aspirations. And we are hoping that we can translate that into a program that changes the career trajectory of nurses, of doctors, and also ultimately improves the well-being of the community in Ghana and in a small way in New York as well.
And this AMPATH collaboration is different in that we talk on what to do. So it is not someone is superior telling you everything that you need to do. And then we also try to think through our programs and their programs and see where we can fit and collaborate at the same level.
We have developed a chronic disease program that focuses on non-communicable diseases such as diabetes, hypertension, chronic kidney disease, and others. There is also new guidelines that we have developed to suit our environment. These guidelines were developed by our team and the AMPATH team, looking at our circumstances. The other peripheral hospitals in the metropolis are now using these guidelines that we have developed. And we are hoping that with time, we will disseminate these guidelines to cover most of the northern sector of the country.
In ONG, we were struggling somehow to develop the protocols. But now we're able to establish a different way to develop these new protocols in different conditions associated with the pregnancy. The impact is important because we are facing high rates in perinatal mortality. And with this project and this impact, at the end we see how my perinatal mortality will drop. This is our goals.
The vision that continues to inspire us to engage with AMPATH Ghana is that ultimately one day populations around the world will have equitable access to high quality healthcare and achieve optimal health.